Welcome back to Zen Zone Health, your go-to channel for practical health advice that empowers you to take control of your well-being. Today we're diving into a topic that's incredibly important, potentially life-saving, and often misunderstood: stroke. Specifically, we're going to uncover 10 unusual stroke signs that are particularly important for women to recognize. Remember, knowledge is power when it comes to your health, so make sure to subscribe and hit the notification bell so you don't miss out on future health tips and insights.
You know how we always talk about the classic stroke symptoms, the drooping face, arm weakness, and speech difficulties? These are the signs that most people are familiar with and can easily recognize. Well, sometimes stroke can manifest in less obvious ways. These subtle signs can be just as dangerous and need immediate attention. One of these is sudden confusion or trouble speaking. This can come on very quickly and without any warning. Imagine having a conversation 1 minute and the next you're struggling to find the right words or understand what someone is saying. It can be incredibly frightening and disorienting. This can be a sign of aphasia, a condition that affects language processing in the brain, often due to a stroke. Aphasia can make it difficult to speak, read, write, or even understand language. It's crucial to recognize that stroke can disrupt the intricate pathways in our brain that control speech and language. These pathways are essential for our ability to communicate effectively. When blood flow to areas responsible for these functions is compromised, it can lead to difficulty expressing oneself or understanding others. This disruption can have a profound impact on daily life. If you or someone around you experiences this sudden change, don't brush it off. Seek medical attention immediately. Early intervention can make a significant difference in outcomes and recovery.
We've all had hiccups, those annoying involuntary spasms of our diaphragm. But did you know that persistent or severe hiccups, especially if they come out of nowhere, can be a sign of something more serious, like a stroke? It might seem strange, but stroke can affect the brainstem, the control center for many vital functions, including breathing and the reflex that causes hiccups. When a stroke occurs in this area, it can disrupt these signals, leading to persistent hiccups. It's like a glitch in the system. Now, I'm not saying that every case of hiccups means a stroke. That's definitely not true. But if you experience sudden, intense, or prolonged hiccups, especially along with other unusual symptoms, it's crucial to get it checked out.
We all experience fatigue from time to time, especially in our busy, fast-paced lives. It's normal to feel tired after a long day at work or after a strenuous workout. However, there's a difference between regular tiredness and feeling completely wiped out. But when you suddenly feel overwhelmingly weak, like you can barely lift your arms or walk across the room, it's not something to ignore. This kind of fatigue can hit you out of nowhere, making even the simplest tasks feel impossible. This kind of sudden, unexplained weakness can be a sign of stroke, particularly in women. It's crucial to recognize these symptoms early because timely intervention can make a significant difference. Think about it. A stroke disrupts blood flow to the brain, depriving brain cells of the oxygen and nutrients they need to function properly. Without these essential elements, brain cells begin to die, leading to serious health consequences. This can lead to a cascade of effects throughout the body, including muscle weakness and profound fatigue. Your body might feel like it's shutting down, and you may struggle to perform everyday activities. It's like your body's way of saying, "Something's not right, we need help." Ignoring these signs can be dangerous, so it's important to pay attention to what your body is telling you. So, if you experience this sudden, debilitating fatigue, don't try to push through it. Resting might not be enough, and pushing yourself could make things worse. Listen to your body and seek medical attention. Contact a healthcare professional to discuss your symptoms and get the help you need. Early diagnosis and treatment can prevent further complications and improve your quality of life. We usually associate nausea and vomiting with a stomach bug or food poisoning, right? But these can also be signs of a stroke, especially when they come on suddenly and without an obvious cause. Here's why. The brainstem, which as we discussed is often affected by stroke, plays a crucial role in controlling nausea and vomiting. Additionally, stroke can affect the cerebellum, the part of the brain responsible for balance and coordination, leading to dizziness and vertigo, which can also trigger nausea and vomiting. So, if you experience these symptoms suddenly and intensely, and especially if they're accompanied by other unusual signs, it's crucial to seek medical attention immediately.
We all know that shortness of breath can be a sign of various respiratory issues, but it can also be a warning sign of stroke. You see, the brainstem, which as we've discussed is often affected by stroke, is responsible for controlling our breathing. When a stroke occurs in this area, it can disrupt these signals, leading to difficulty breathing, rapid breathing, or a feeling of being unable to catch your breath. It's like your brain is having trouble sending the right messages to your lungs. Now, I know that shortness of breath can be caused by many things, but if it comes on suddenly and severely, especially with other unusual symptoms, don't hesitate to call for help.
Seizures are scary, aren't they? They're caused by abnormal electrical activity in the brain, and while they can be caused by various factors, they can also be a sign of stroke. When a stroke occurs, it can damage brain tissue, leaving behind areas of scarring. These scarred areas can sometimes become electrically unstable, leading to seizures. The type of seizure can vary depending on the location and extent of the stroke. Some people may experience convulsions, while others may have more subtle seizures, such as staring spells or brief periods of confusion. Regardless of the type of seizure, it's essential to seek immediate medical attention. Pain is our body's way of telling us that something is wrong, right? It's a signal that something needs our attention, a warning that we should not ignore. And when it comes to stroke, pain can manifest in unusual and unexpected ways. While a sudden severe headache is a well-known stroke symptom, stroke can also cause pain in other parts of the body, such as the face, arms, or legs. This is often due to damage to the brain's sensory pathways, which are responsible for transmitting pain signals. The pain can be constant or intermittent, and it can range from mild to severe. It's important to remember that pain is subjective, and what one person considers unbearable, another person might tolerate. So if you experience any sudden, unusual pain, especially if it's accompanied by other stroke symptoms, don't dismiss it. Get it checked out. Early detection and treatment can make a significant difference in outcomes. Always listen to your body and seek medical advice when something feels off. Pain is not just a nuisance, it can be a crucial indicator of serious health issues. Our sense of hearing is precious, and when it's affected, it can be incredibly disorienting. While many things can cause hearing problems, stroke is one that's often overlooked. You see, stroke can affect the brain stem, which plays a crucial role in processing auditory information. When a stroke occurs in this area, it can lead to hearing loss, tinnitus, ringing in the ears, or difficulty understanding speech. It's like the brain's ability to interpret sound signals gets scrambled. So if you experience sudden hearing changes, especially if they're accompanied by other unusual symptoms, don't hesitate to seek medical attention.
Fainting, or syncope, is a sudden, temporary loss of consciousness. It happens when there's a decrease in blood flow to the brain, and while it can be caused by various factors, it can also be a sign of stroke. Think about it. A stroke disrupts blood flow to the brain, and in some cases this disruption can be severe enough to cause fainting. Additionally, a transient ischemic attack, TIA, often referred to as a mini-stroke, can also cause brief episodes of unconsciousness. The key takeaway here is that any unexplained loss of consciousness should be taken seriously and evaluated by a medical professional.
Our brain is the control center for our thoughts, emotions, and behaviors, right? So it makes sense that a stroke, which affects the brain, can lead to unusual behavioral changes. These changes can vary depending on the area of the brain that's affected, but they can include sudden irritability or agitation, unexplained mood swings, apathy or lack of interest in things you used to enjoy, depression or anxiety, impulsivity or poor judgment, and aggressive behavior. It's like the stroke has disrupted the delicate balance of chemicals and neural pathways that shape our personality. If you or someone you know experiences sudden, drastic behavioral changes, especially after a suspected stroke, it's crucial to seek medical attention.
Thanks for joining me today on Zen Zone Health to explore these 10 unusual stroke signs in women. Remember, recognizing these signs and seeking immediate medical attention can make a world of difference. By understanding the subtle ways stroke can manifest, we empower ourselves to take action and potentially save lives. Don't forget to share this video with your loved ones, and subscribe to Zen Zone Health for more empowering health insights. Stay healthy, everyone.